I'm Dr. Bae from the Castle University. I'm now the Secretary General of the Castle 2018.
I'm Seungwon Lee from the Catholic University of Korea. Today we have here world-renowned hepatologist from Tokyo, Dr. Omata. Please introduce yourself, please.
Well, I was born in Japan 1970. Oh, no, sorry, 1945. And then I went to the States for 6 years. And then went back to my university, which I graduated in 1979. So altogether, 17 years in Chiba University, and then altogether 17 years at University of Tokyo. When I was 46, I took the chair of the University of Tokyo gastroenterology. Since then, I worked till 2009. And from 2009, the governor asked me to take care of the 2 hospitals, and then 1,000 beds, and then 1,500 employees there. But instead, in addition, I'm doing the research and education there too. So that's my career.
Thank you.
Thank you. I really thank you for your interview. Today, during your lecture about the multidisciplinary approach for the treatment of HCC, you emphasized the heterogeneity of the intra and or interlobular of single or multiple tumors. I'm sure it is very important and interesting, and then it will guide us to treat the HCC effectively. So, do you think we can use the heterogeneity to treat clinically?
Right. Well, I was in this field, Hepatology Society, for 40 years. But recent trend is that, for example, if you take a cancer oncology, you got to go beyond the barriers. And I was attending the sessions, but the majority are the same in a sense that conventional hepatology. But if you go to the American Society of Oncology, ASCO, it's a huge number of the people gathering, like sometimes 10,000, 10,000, 100,000, and then talking about the cancers. So what they are discussing about? They are discussing about the PD-1 checkpoint inhibitors, multiple kinase inhibitors. But all those drugs or the ideas comes from understanding of human genomes. Remember, the 1979 HB virus discovered and then sequenced. It was only 3,200 nucleotides. Only 3,000 nucleotides. Human genome, 30 billions. And so for a long time, we couldn't find out what's going on inside the cancer because it's so huge. But 2014, about 200 different types of cancers, several thousand tumors sequenced. We now have libraries. Why not? We understand the cancer of the liver, hepatocellular carcinoma. We are a bit behind to other fields. That's what I stressed about.
So, what will be the future in the treatment of HCC? Will genomics and precision medicine take place, and how long will it take?
You see, when you talk about hepatology societies, majority of the audience comes to HBV treatment, HCV treatment, because you simply prescribe the drugs. And if you go to the cancer sessions, some experts come with a TA, and some come with the surgery, some come with the transplantation, or maybe RFA or microwaves. That's needed, the techniques. But the super extreme is if we prescribe drugs, patient can survive for 5 years. Maybe that's the future of the hepatology. Hepatology don't need expertise. We just simply prescribe drugs. That's the future. But to do that, you better understand the tumor inside, what's going on there.
Yeah. This question is a little bit beside this subject. You still passionate in the field of the hepatology. So I want to ask you your view of life in the hepatology, and could you tell us some message if you have to the Asian hepatology fellows? I want to build life.
Well, first of all, the 75% of the liver disease in Asia, which is unlike cardiovascular renal, because cardiovascular renal may be predominating in the US or the European countries. So the reason is rather simple, the viruses. So we first, the one, have to get rid of the viruses, but still many patients suffer from hepatocellular carcinoma. Again, I repeat, virus is small genomes, and then human cancers is a big one. So I think we know that we learned the strategy by studying HB virus and CB. So why don't you why don't you apply to the human genome? That's what I want to say.
Yeah. I want to ask again the build life in the future.
What do you mean? Huh? My life?
Yeah,
Personal life or academic life?
Academic.
Well, of course, academic life. Well, for the sake of patients, I'm still seeing the patients maybe 2-3 times a day, not week, and then maybe I'm the one that who treat the most SCB patients for the last 2-3 years. In fact, my hospital spent almost 30 million US dollars just to get rid of the virus from 500 patients. So my life is like 7 to 11. I'm working at 7-11 still, because I have something to do, especially patient care, studies, academic research, and education. And I hope I can continue that.
Oh, 7 to 11.
Until I die.
Thank you.
Okay, thank you very much. Dr. Lee, thank you very much.
Thank you.
And then Dr. Bai,
Thank you so much.
my friends.